This video is intended to help you identify moles that may need to be assessed by an appropriate professional. I'm Dr. Alan Siegel, dermatologist from the Skin Cancer Assessment and Treatment Centre, Melbourne, Australia. How do you tell if a mole may be dangerous? You may think that only an expert can pick suspicious changes in a mole. However, there are a number of signs that anyone can identify that suggest you should see an expert. These signs can occur in harmless moles, but it is reasonable to have an expert confirm that they are harmless. Your attention may be drawn to a mole because it is itchy or irritable. If there is an obvious cause for this, for example a recent knock or something rubbing on it, you can ignore this sign if it subsides in a reasonable time. However, if this persists or comes back repeatedly for no obvious reason, this may be a sign that further inspection is necessary. This sign might mean an infection or irritation, but a skin cancer needs to be excluded. If a mole is persistently tender or sore on touching, further investigation is warranted. The fact that a mole is not itchy, irritable or sore does not necessarily mean that it can't be dangerous. Some very serious skin cancers may not show these signs. The abnormal appearance of a mole is probably the most important sign of a problem. Many people feel they do not have the expertise to pick an abnormal mole from its appearance. Nevertheless, most people do have an innate ability to visually recognize that something is not normal. For instance, we can intuitively pick somebody acting suspiciously. Similarly, many abnormal moles look odd to the untrained eye. If a mole looks odd, your own perspective should not be ignored and you should seek expert advice. Your concern that a mole is suspicious may well be relieved by an expert opinion. Many abnormal moles look different to surrounding moles. They tend to stand out. Sometimes the mole can look out of place from a distance, but this may not necessarily denote an abnormal mole. Normal moles usually have a smooth outline, whereas abnormal moles may have an irregular outline. Normal moles generally have a fairly even colour throughout, whereas abnormal moles may have marked differences in their colour that may look blotchy. Whether a mole is flat or raised above the surface gives no indication if it is normal or abnormal. Both normal and abnormal moles may either be raised or flat. The sudden growth of a mole usually means that some abnormality has occurred within it. However, this may also mean irritation or infection. If the mole continues to enlarge when irritation and infection have been accounted for, then the mole needs to be assessed further. Unexplained or persistent ulceration or bleeding can be an important indication of infection, irritation, or a skin cancer, and urgent assessment is necessary. Yourself, a family member, or a friend may be the first to notice something unusual in a mole. Many of the signs discussed can relate to normal moles, but if you have concerns, you should consult an appropriately qualified medical practitioner for further review. This video has been brought to you by the Skin Cancer Assessment and Treatment Centre, Melbourne, Australia, by dermatologist Dr. Alan Siegel.